A concussion is also called a mild traumatic brain injury, which is a brain injury caused by a blow to the head or a violent shaking of the head and body, which causes temporary unconsciousness of the person.
You're probably wondering what the cause of a concussion is. The etiology of a concussion is a direct blow to the head or trauma. Some common ways to get a concussion include fights, falls, playground injuries, car crashes, or bike accidents. Concussions can also happen while playing in any sport or activity such as football, hockey, soccer, or skiing.
Increase your risk of getting a concussion is participating in high-risk sports. The risk is further increased if there is a lack of proper safety equipment and supervision. Falling, especially in young children and older adults. Having a previous concussion, for example, if athlete A had a concussion when he was 7, he is more prone to getting another concussion than athlete B who had never had one.
There are many signs and symptoms for concussion. Signs include the patient appears dazed, stunned, or confused, memory loss, lack of coordination, poor reaction time, loss of consciousness, behavior, mood, or personality changes, unequal, dilated, or unresponsive pupils, and lastly, otorrhea. Symptoms include headache, nausea, vomiting, dizziness, or even loss of consciousness. The tricky part to concussion is that there is no diagnostic besides signs and symptoms. There is no test that you can do. A concussion does not show up on an X-ray, CT, or even MRI. You may need to be hospitalized overnight for observation after a concussion.
Consequences of returning to play from a concussion could cause serious damage to the person that had that concussion. Many cases of returning to play too early has led to serious brain damage and life-threatening injuries.
RTP, Natasha law mandates that the secondary level of school concussion have to be prevented by the coaches, staffing, etc., which also means the athlete cannot come off the field and go right back on. The athlete has to go see a physician. Also, the doctor has to release the athlete to start RTP. The athlete has to be sinus symptom free to start, or the doctor has to set a specific date. There are 5 steps in 5 days of this process. The point of doing this is to keep the athlete's heart rate up and to make sure that the signs and symptoms do not come back.